Next to be recognized is Roxanne Gordon, a pediatric orthopedic nurse in the inpatient nursing unit at Shriners Hospital for Children. When Shriners Houston's sister hospital in Galveston was flooded during Hurricane Ike, the Houston facility took in the patients from Galveston's pediatric burn unit, shouldering this load for 9 months, well into 2009. A soft-spoken, gentle, and knowledgeable nurse, Roxanne, set about educating herself on the care of burn patients. She then proceeded to educate the rest of her orthopedic colleagues on the differences in caring for the two patient populations. Roxanne developed a comprehensive online training module with links to pictures, diagrams, literature, and other training material for both burn patients and orthopedic patients. She even created patient education materials so that the orthopedic and burn patients would feel more comfortable with one another. Roxanne tackled all of this outside of her regular job as charge nurse on the night shift. In that role, she ultimately is responsible for all that happens during her shift and for making sure the staff is secure in the care it is providing. She's a clinical care expert who advocates for patients whenever it's needed and goes out of her way to make sure the needs of her patients' parents are met as well. Roxanne also is an expert in electronic medical records and a member of the staffing committee. Her boss and nominator reports that Roxanne always exhibits a gentle touch, dependable work ethic, and excellent customer service skills. It's clear that her flexibility, kindness, and knowledge make Roxanne Gordon a truly outstanding nurse. I'm very proud to say congratulations, Roxanne.
I think that when I was a young child, I remember in elementary school you had to draw a picture of something you wanted to be when you grew up. And for some reason I drew a nurse. I really didn't know why, but that idea kind of faded along the way. But when I was a teenager, my grandmother fell ill, and she was bedridden until her death in 1987. And I watched my mom and other family members, and like a wonderful caregiver, take care of her during that difficult time until she passed away. And then I'd already started college by then and kind of on a different path. But I had an opportunity in my church to work with children, and through that work with children and the experience with my grandmother, I made the decision along the way to go ahead and be a nurse. And so I kind of, in the final days of my other degree, I kind of changed courses and started all over again in the field of nursing. So. Well, I think you have to be careful about life experiences when you think about things that you're using to draw on to complement your career, because you always have to remember that just because you have a certain experience in your life, that doesn't mean that that other person, that you know exactly what that other person is going through. But I think, you know, in the same way, you have to take some part of life and really, in terms of caring for a patient, I want to care for my patient the way that I would want a family member or myself, if I was in that position, to be cared for. So you draw on the things in your life that will either advance the profession or would advance the care of the patient to really make their day better and their recovery better.